Welcome everyone. I'm Brett. I am the student sports representative for the APTA Student Council. I'm currently a third-year student at Oregon State Cascades in Bend, Oregon.
Hi, my name is Mike Reinold. I am the current president of the American Academy of Sports Physical Therapy of the APTA.
All right. Well, thanks for joining us, Mike. So, for me, one of the things I thought has always been helpful is hearing from professionals who are already in the sports field about how did they get there? What was their journey kind of like?
Yeah.
So can you kind of walk me through what steps did you personally take to just be in the position that you're in now?
I think that's a great question. I got started before the internet, technically, I think, so I don't know if that dated me too much. But I remember at the time, I always knew I wanted to specialize in sports, and specifically baseball was a passion of mine. And what I tried to do is I tried to seek out who were the leading experts at the time. And back then, before the internet, it was a little bit harder to do, but you look through the literature and you look at the people that are publishing on the topic that you're interested in. And what I did was I found them, and it was essentially the American Sports Medicine Institute in Birmingham, Alabama, with Kevin Wilk and Dr. James Andrews and Dr. Glenn Fleissig. And I sought them out, and I cold called them on the phone. We used to actually call people on the phone. I called them, and we started talking. They answered the phone. And I did a student rotation down there. Then they asked me to stay. They actually wanted to know if I wanted to work down there, and I said, I'm from Boston. I don't know about Alabama. This is different for me. But then I did a fellowship, and I did a fellowship under those three, and Kevin Wilk, my mentor. And I really do think that was what kickstarted my career, because they instilled the passion of this profession into me in sports, and I saw how they were so dedicated to our field, and it was something that, as a mentor-mentee relationship, that I really grew with. So I worked down there for several years and associated myself with some of the best baseball sports medicine people. And, luck and timing came together, and I got an opportunity to work in professional baseball. So I got lucky, but, I'd like to think that, the connections I made and seeking out that mentorship is probably what really helped.
Yeah, cool. Awesome. So now that you're kind of in this position, and I know it differs a lot for, depending on what setting you're in, what athletes you're working with, but for you personally, what does kind of a typical day look like for you right now? And what opportunities are other sports PTs doing that you personally may not be doing yourself?
Yeah, there is a wide range of opportunities in sports for physical therapy. Myself now, I always think that I can't take away clinical care. That is something that makes me authentic. I educate, I work with consulting and leadership roles. I feel like if I were ever to stop working with athletes hands-on, that it would be a little bit less authentic in my teachings and my ability to lead others. So it's very important for me that I continue to get my hands dirty. So I own a private practice up in Boston, Champion PT and Performance, and we treat athletes. We have a big gym and a sport physical therapy location. I'm a medical advisor for the Chicago White Sox at the time, so it's more of a leadership role, more of a mentorship role in that, and that's where I've started to evolve. So for me, it's that in combination with the presidency of the American Academy of Sports Physical Therapy, where I try to combine hands-on care with leadership. And for me, my style is more of like a mentor leader versus a dictator leadership. I really want to see that next generation grow, because I'm on the descent, Brett, and you're on the ascent, right? I want to see you grow, and I want to see you become better. So that's what I've kind of dedicated my career towards now.
Yeah, I know like a lot of people coming into the sports field, some of them wanted to go into like kind of the research route. Some want to go into a little bit more of like sideline training room coverage. So it's like, I feel like depending on the setting that you're in, athletes that you're working with, and like what you want to do, there's so many different routes that you can go to fit your needs and what you're looking for, which is cool. So you kind of talked about, coming up, you had Wilk and Dr. Andrews and all those guys as your mentors. How has, your perspective kind of shifted from being mentored from them to your spot right now, where you're kind of more the mentor for a lot of other students and professionals coming up now?
Yeah, it's humbling, it's daunting as well, that of a lot riding on your shoulders when you're trying to mentor people. But for me, again, it was something they instilled in me that is what you do. Even running for volunteer leadership within the APTA, it's something you do to give back to the profession. So for me, as I continue to evolve to more of that mentor role, it's all about being, you want to see people get the best out of themselves. And it's not about you, right? And I think that's an important aspect of sports physical therapy, and really all of physical therapy. But with sports, it's not about us. We have to be the humble servant to the athlete in sports. They have a profession. They need to throw a ball tonight, for example. So my job is to get them on the field as fast as I can. And it's not about my needs or my desires, it's about what they need to do their job. So I think with sports, you learn that, and you learn that with the athlete, and then when you apply that to your clinical students that you have and people that you mentor around the country through education, I think that's where it really comes from.
Yeah, I feel like that's super helpful. I feel like coming up for me, like as a student, sometimes it's almost a little nerve-wracking to like reach out to mentors or anyone like that, just because you don't know how they're going to respond.
Yeah,
so.
but the barrier to entry of that is so low now, right? You can DM somebody on Instagram, and you're probably going to get a reply.
Their emails out there.
Yeah, there's a good era right now where people want to communicate more. Twitter, great example. It's so easy to just like have a quick conversation back and forth. But I think it's super important though that you do what we're doing here, right? We're at APTA CSM in Boston right now. You have to be face to face as well, right? And you have to network, especially as a student, an early career professional. You have to put yourself out there a little bit to try to find those people, right? Especially if you don't inherently have that mentor with you, you can find opportunities. You can find the right person through that, and I think you'll be surprised at how eager the veteran leaders within the American Academy of Sports Physical Therapy are eager to help mentor somebody like you.
I feel like
just
that's super
out.
Helpful, like hearing from your guys' perspective that you guys are wanting to and willing to just take on a student and help them learn and grow and stuff like that.
Right.
So.
We got into this profession to serve, to help others, right? And at some point, it's not just about your patients or your athletes, it's also about the next generation.
That's good. Awesome. What kind of distinguishing personal characteristics do you feel practitioners within the sports field should have?
Yeah, I feel like we've covered that indirectly with a couple of things, as you can tell, right? But it's really a lot more about communication, and it's about knowing that the athlete needs to trust you. And that's an important part in sports. They need to trust you, especially when their career, which might be multi-million dollars depending on the level you're at or potential in the future, they need to be able to trust you. So you have to have a personal communication, personal connection with that person, or it's going to be really hard to get them to buy into what you want to do. And again, it's not about what you want to do, it's what you feel like you're putting them in the best position to succeed. So you have to be strong communication, you have to understand that you are there to serve, right? I know a lot of people when they first start getting into sports physical therapy, and I was guilty of this earlier in my career, I published a lot of studies on EMG activity, for example, shoulder exercises. And I went into baseball thinking like, this is the best. There's a way. And then you realize when you start working with more and more people that there's a lot of ways. There isn't always just one way. Even though we try our hardest to scientifically prove the best way, you have to understand that. So you can't take it personal when there's a subtle variation of what you may want to do. You have to understand it's about serving the athlete.
Yeah, I feel like from the student perspective, that's always the toughest transition making, going from like school to actually working with patients, where it's like you have this condition, like you treat it this specific way, when it's just not the case in the real world. When you're actually working with patients out in the clinic, it's like,
and unfortunately,
depends on what their goals are.
That's
depends,
most of
that. Yeah, I know. It's like it depends on what their goals are. What do they want to do? What works for them? It's just different for everyone.
That's right. And,
so.
and timelines, like when they need to be. Yeah, there's a lot that goes into it. And as an early career professional, when you're coming out of school, that's one of the harder things to understand, right? You come out of school with a bunch of great knowledge, a decent amount of skill set, even though you're about to improve over your first few years as well. But that lack of experience, not in a bad way, but that just lack of experience, it makes it difficult for you to have quick judgment, right? And that's what sometimes people, they want to rush that a little bit and just realize that school's to prepare you for knowledge and skill, and then you need that experience, and you need to go into that humbly and with an open mind and a growth mindset that I need to learn still, right? And then once you have that experience, that's when that's when the profession gets fun, because the algorithm in your head clicks and you start to see patterns, and then you can really, really help people. And that's why we do it.
Yeah, I feel like it's so frustrating because it just takes time and experience
Yeah.
to get to that point.
But but it's back to the mentorship part though. The reason why you seek out a mentorship or a residency or a fellowship, through the APTA, it is because those people are trying to help you get there faster. So you get to learn all their database in their head and apply it to your head, right? And that's, I like to say, I'm a mutt, right? I have a lot of mentors, a lot of people that have taught me things. You put it all together and that becomes you. It's different than everybody else, but it's a combination of the things that have influenced you. It's important to feel that way.
Definitely. Just for like any students who aren't really aware of it or haven't looked into it much themselves, can you talk a little bit about some of those student or mentoring programs like residencies or anything else that they can do or partake in as a student?
Yeah, residencies and even fellowships now, they're exploding. The amount of them are going through the roof. So our advice to students that are looking into residencies is always pretty simple: is the residency needs to help you achieve your goal. Sometimes we see students that look into a residency almost because they're unsure of themselves, which isn't a bad thing, right? To get some more confidence through mentorship there. But I want you to say, this is going to help me get to my end point. That's what you need to do when you pick a residency. And there's so many residencies now that can help you do that. It's pretty neat. Right? So you have that, but look, not everybody can do that, right? Economically, geographically, there's reasons why maybe you can't do a residency. There are ways you can do that, right? The Sports Academy has a ton of online resources. Our SIGs, our committees, everybody's there to help try to grow the generation of our profession. So even if you don't have the ability to do that, I think if you get involved with the Sports Academy, you'll really find some good mentorship, but hopefully friendship down the road. And I think that's how we all feel. We see each other, a few times a year at these meetings, and it's just like 20 years ago when we first met. You get to enjoy the time with your friends, but also learn from them as well.
Yeah. Can you talk like a little bit more about how students can get involved with the Sports Academy? Because for me, like, I heard that over the last couple of years, but I never really knew, how do you get involved with the Sports Academy? How do you actually do that? How do you actually reach out, communicate, get involved with some of the SIGs and some of that stuff?
Yeah, well, I mean, first step's joining, right? That's step one, obviously. But then from there, it's reaching out. The website always has ways to communicate. But for example, at CSM, head on over to our booth, and you can talk to some people there. We have a ton of students, actually, that have been volunteering at the booth. We have a lot of veterans that are there as well, so you can kind of learn a little bit about the history of the Academy. But go to the booth, try to network with them. And then what you do is, I think you reach out again, right? So, maybe you're at a continuing education course and somebody's a leader within the Academy. Just reach out and say, how can I get involved? Nobody's ever going to not want you to get involved, right? Everyone, they're very eager for you to step up and say, I want to get involved. And we need that. So, it's hopefully something that you will find rewarding, right? So that you enjoy it yourself. But I think you'll grow a lot faster in that environment if you put yourself into that.
And kind of going off that, like, we've been talking a lot about what students can do right now to help them find their way or find a path into a career in sports PT. But what do you feel like, students, first year, second year, third year students can start doing right now to, prepare them for a future career within that specialty?
Yeah, well, don't do what I did, right? Because I'll tell you this, I instead of buying my neuro books and my pediatric books, I bought sports medicine books and just went to the library for neuro. But don't do that. No, I think there's so many educational resources now that you can get involved with. I think you have to start saying, what are you passionate about? That's the first thing you need to identify is, what are you excited about? This is a very rewarding field because we help people, but you need to enjoy what you're doing every day, right? That's super important. If you don't enjoy your job, it's not going to be a fun career. So find that niche that you really enjoy. I'm a big niche fan, right? Myself, all the therapists that work at our facility all have strong individual niches. Find that niche and then become the best you can at that. If you want to work in baseball or gymnastics or the fitness athlete, whatever it may be, there's so many now. Go in there and devour as much information as you can about that, become an expert, and then start working with those people. day one, sure, you're still going to have a variety of, gen pop orthopedic people probably, but over time, people will see your expertise and they will see that, and you will slowly get more and more specialized, and then you're at a really great point in your career when you can do that.
Yeah. I feel like that's super good advice for like any student or anyone coming up. Is there anything else you feel like students or even early career professionals should know about just entering a career in the sports PT field? Or
Yeah, I mean, it's a wide field, right? So there's collegiate athletics, there's professional athletics for so many different things, Olympics. Even if you just look at our SIGs, there's so many different opportunities. Adaptive athletes, tactical athletes, just so many different subspecialties. I think if you really want to get where you want to go fast, I think you niche down as much as you can and say, this is the type of athlete I want to work with. Or this is the type of injury. I want to do ACLs, I want to do Tommy Johns, whatever it may be. But really niche that down, and I think that will focus your energy towards becoming as best as you can at that. I think that would be a great start.
Yeah, I think that's great. You mentioned like the sports academy. Is there anywhere else where if students want to keep learning more about sports PT, where would you kind of direct them to?
Yeah, I mean, I would say find out which people are doing what you want to do. That's a great example. So again, just for myself, if you like baseball, right, if you followed us on social media and you follow what we do, you'll probably get a lot out of that. Right, that we have tons of specialists within the sports academy in different niches. If you follow them and what they do, I think you're going to really start learning. And then, believe it or not, like just network, start communicating with them, be present, right? Put yourself out there and in front of those people, and over time, you'll become one of them. I think that's important.
Yeah, that's great. Okay, do you have anything else to add? Or?
No, that was great. Thanks so much.
Yeah, thanks for,
Good job.
I know you got a busy week, so thanks for taking the time to come join us.
Yeah, appreciate it. Good luck in your career. Take care.
Thank you.
Yes.
Thank you. Appreciate it.